Hello, welcome back to Pharma Training Solutions. Today I'll be briefly explaining the protein synthesis inhibitors or the antibacterial agents. Remember, this is Pharma Training Solutions. In case you haven't subscribed, click that subscribe button and support us. Today I'll be discussing protein synthesis inhibitors, but of course we know that even bacteria, they require proteins in order to survive within our bodies. Hence they synthesize proteins. Thus we have those which inhibit 30S subunit, ribosomal subunit, and those which inhibit 50S ribosomal subunit. The 30S we have tetracyclines, aminoglycosides. 50S we have carboxyl macrolides, glycosamides, and linezolides. Now the macrolides, these are bacteriostatic, and they bind vertebrate the 50S ribosomal subunit as said above, blocking translocation of tRNA from the acceptor to the donor side. And of course with this we are also blocking transpeptidation and chain elongation. Of course when we block chain elongation, it means that they cannot form functional proteins. Examples of erythromycin, azithromycin, clarithromycin. These are used in respiratory tract infections such as community-acquired pneumonia. Of course, we know it. Genital chlamydia, and effective in gonorrhea. Azithromycin is also effective in UTIs and all those. Clarithromycin is a component of triple therapy, H. pylori, and also used in Toxoplasma gondii. Side effects we have GI irritation or skin rashes. Let us look at clindamycin. It's also bacteriostatic. It acts through the same mechanism as macrolides, which means it inhibits 50S subunit, I said above. Because the clindamycin inhibits 50S subunit. Now it active against pneumocystic Geravosi or the pneumonia. This is an infection in what? In AIDS. If it is in combination with pyrimethamine, or protonistic infection in HIV/AIDS. Also it can be used in toxo. Now it also used in skin or soft tissue infection. This clindamycin caused by staph or strep. Remember, for me, I'm talking about definitive therapy. However, in practice, we just use for infections. Chloramphenicol, this is a bacteriostatic, also inhibits protein synthesis by binding reversibly to the 50S ribosomal subunit, and this inhibits peptide chain elongation. Peptide chain elongation or extension of polypeptide chain, used in salmonella infection, typhus, typhoid, and eye infection, because we have the cough eye drop. Side effects we have GI distress, grey baby syndrome. Why? Because neonates have not yet developed the metabolism for chloramphenicol, which is the glucuronic acid conjugation by the glucuronosyl transferase enzyme. I hope you are aware of that. We shall talk about it when we reach pharmacodynamics. You can also refer to those notes. Which side effects we have: vomiting, weakness of muscle, paralysis, hypothermia, and then of course the gray color, which is due to decreased red blood cell synthesis. Also, it can cause bone marrow suppression. So I have 3 side effects: GI distress, grey baby syndrome, and bone marrow suppression. I don't have nausea, I don't have vomiting. Thus, chloramphenicol should be used with caution in neonates and even in pregnant women. Since it is bacteriostatic, shouldn't be combined with the bactericidal antibiotics. Tetracyclines, of course, inhibit protein synthesis by binding specifically to the 30S ribosomal subunit, of course inhibiting the elongation of the chain. Of course, the absorption is inhibited by calcium, this iron, magnesium. Thus, it should not use concurrently with calcium, or should not be taken with milk. When you're dispensing these drugs to the patient, you have to tell them, please, this and this and this, don't take them at the same time. This is a common interview question. They ask you have a prescription having tetracycline or doxycycline together with calcium. What do you do? Of course, the patient should take one after the other. Which one should come first? Of course, the drug should come first. You have to give doxycycline first, later on after like 1 hour, 2 hours you give calcium, because calcium is a supplement. You don't give a supplement first and then you take the drug later. Examples we have tetracycline, doxycycline, minocycline, and of course we know TO or tetracycline ointment is used in those infections in the children, and also is a component of triple therapy. Again, doxycycline is used in combination management of brucellosis, prophylaxis in malaria for doxycycline, and again used in UTIs. I'm sure you're aware of this and you know the dose. So side effects of GIT: irritation, discoloration of discoloration of permanent teeth or enamel. That's why they are contraindicated in pregnant women and children below the age of 8 years. But why do we use the ointment? Because it is what? It is topical. It acts topically. Aminoglycosides, these are the other 30S ribosomal inhibitors. Now, these are the only bactericidal protein synthesis inhibitor. This objective is common. They are bactericidal inhibitors of protein synthesis. They penetrate this bacterial cell via the bacterial cell envelope. Via the cell, they penetrate the bacterial cell envelope via the oxygen dependent. Via the oxygen dependent transport. Via the oxygen dependent active transport. Now, this is what makes them bactericidal. They penetrate the bacterial cell envelope via the oxygen dependent active transport, or dependent on oxygen dependent active transport, and of course they bind to the 30S ribosomal subunit and interfere with protein synthesis. So when you're talking about the mechanism of action of aminoglycoside, it is not like the other protein synthesis inhibitors. First, talk about how they penetrate, because we know that the combination of cephalosporins with gentamicin is effective. Why? Is because as the cell wall inhibitors decrease the integrity of the bacterial cell wall, the aminoglycoside can easily penetrate, and hence since all of them are bactericidal, so we have that synergy effect. Now, these are commonly used as IV. They are not available as tablets. Gentamicin, neomycin, streptomycin. I think neomycin is available as an ointment for the skin or eye. Clindamycin, namicacin, used in sepsis in combination, of course, with beta-lactams. I've explained the reason why. The synergism, 1, via the different mechanism of action. 2, also this one enables penetration of the other one. So ensure you can guess those one and understand them. Streptomycin and namicacin are used in clindamycin, they are used in TB as second line. They also topically have gentamicin and neomycin, they are used in eye infection. Side effects we have nephrotoxicity and toxicity. That's why it have to be used with caution in patient with kidney disease or CKD. This has been a short presentation on protein synthesis inhibitors. You can always refer in your notes for more information, or you can contact us via WhatsApp, email. I always remain Wilson from M Pharma Training Solution. Subscribe to the channel in case you haven't subscribed. Leave a comment on how you can improve. Like the video. Thank you very much for watching and listening to me.